Recording in progress.
So, good morning, everyone. Thank you all for being here. First, I just want to acknowledge the tragedy we saw in Texas yesterday. Just a devastating situation. I know Russell has some resources that he'll put out during this meeting for you that hopefully you can share with your educators and families. But it's just another reminder of how hard this work is and the problems we have in this country. So I just want to take a minute to acknowledge that. I also know that, at the beginning of the year, I often belabor the point about making sure your safety plans are in order and you've done all your drills. I just think it's something we probably need to look at more than just at the beginning of the year, throughout the year. So it's something you just want to, check out for your district and make sure that that you feel like you're in a good place as far as that stuff goes. In regards to the testing, I just want to kind of give you the process for the rest of the year, for the summer and then the fall, and then Russell will go into all the details. But, essentially, the statewide COVID testing program is going to remain in place for the rest of this whole school year. I know we said we might stop it in April, then we said we're going to go further in May, but I think it's best to just continue it for the rest of this year. We have seen a downtick in the wastewater, and that's good. But we're also just in a very different place, right? And I'll talk about that at the end as far as we go. For the summer, DESE's going to continue providing self-tests for symptomatic testing. We feel it's important that you guys have the tests on hand, but kind of like the staffing, the software, and all the other current services that CIC Health has aren't going to be available. And then for the fall, we are not going to operate the statewide testing program anymore, but schools can implement their own testing programs. We've talked to DPH and the medical advisors, and basically what we're going to say to you and what you'll see in the future is, if you choose to set up your own testing program, we'll help you with like some of the purchasing and stuff. You can use our bid list. We won't have funding to help you. Have to use your own money, but you could use our bid list and stuff like that. But we're really going to recommend that you choose to implement symptomatic rapid testing only. You can use our state contract to buy those things, but I don't think you should go do more than that. That's a recommendation for the medical people. Obviously, we're thankfully in a much different place than we were 2 years ago when we first stood up these testing programs. I know the incredible work that you guys have done and the incredible burden it's been to make sure that we kept our kids safe, and you helped get us through that. And we're just, in awe of your abilities, and we're amazed by and thankful for everything you've done. But, thankfully we're in a much different place, right? We're going to have to learn to live with this thing. The medical people are saying that our widespread access that we have in other settings makes this school specific program really unnecessary at this time. Our vaccination rates are among the highest in the country. And, the focus should be on symptomatic testing only. We'll continue to remind people to tell students and staff to stay home when they're sick. I think that's always an important thing. The consensus among the medical professionals is we may continue to see a downtrend in the wastewater data and in the cases this summer. But as I told you earlier, we should not be surprised if later in the fall or early winter, another variant pops in, which is why I kind of had recommended in the past that you guys think about some stockpiling of your own test kits and maybe even mass. I think as of like the beginning of May, we just have like 90% of the population that's got at least one dose in Massachusetts. I think like more than half, maybe almost 60% is fully vaccinated with a booster shot. There's still some work to do, especially with some of the younger kids, and we encourage boosters. Obviously, we'll put out more information about vaccine clinics, but this is the kind of process we're following. We're going to continue this program through the rest of the year. We're going to give you tests in the summer for summer school, or we're going to scale back some of the staffing and software. And then in the fall, we're going to kind of de-implement the testing program, but support you on the statewide contract would have to come with your funds. And we recommend symptomatic testing. And I think that's pretty much all I have to say on this. You'll get a document, but Russell will kind of walk you through all the details. Russell, are you here with us?
Yeah, thanks, Commissioner. Glad to take it from here. And thanks very much for those opening words. And if anybody joined late, I'll be going back over all the same information, and we'll make sure you have the PowerPoint from today. like the commissioner mentioned, a memo to describe more about those details and lots more information as well. So thanks very much. Just to really get us started, I appreciate, Commissioner, the way you started with talking about the tragedy that we saw in Texas yesterday. Just know, as educators, we're coming together today feeling, very raw, very upset, very emotional about these national events, these national tragedies. And I think having that coupled with what's just recently happened in Laguna, in Buffalo, thinking about the 2-year anniversary of George Floyd's death, I think we come together today with a heaviness. And I think we also come together today because we so firmly believe about the power of schools, about the power of safe schools, and really wanting our children to be safe and supported and frankly loved in our buildings. And so we just want to begin today by offering some resources that maybe you would find helpful. There are a lot of resources out there, but just knowing that we have to have conversations with our kids today as parents, as educators. And so just how do we talk about violence? Everything that I mentioned, from, again, Buffalo, Laguna, George Floyd's death, the tragedy in Texas, is how do we talk about violence with our children? And we just wanted to offer some tips, some resources, including the National Parent Helpline. I'm sure that you will be on the front lines dealing with parents today. Just need that extra support. We know how much you're going to be providing it, but there are also other resources like the National Parent Helpline to turn to. And I know that, when my son was younger, I turned to Common Sense Media a lot for resources on what, how to think about the media that he has always been absorbing, and just, so appreciate this resource too from Common Sense Media. So as Commissioner said, we appreciate how much you all have already done this year. We're not done yet, and the world is always at our doorstep, and we just want to make sure that we are all working together to just make our schools safe and in supportive places for our children to learn and for our staff as well. So we hope you find those resources helpful. We'll turn now to the program that we have planned for today. Appreciate Commissioner Riley kicking us off. As always, you have me and Lauren Wu here with you. Always Jeremiah and Meg as well, and we'll make sure we pause a lot as we go through the details for Jeremiah and Meg to fill in. And we're also really pleased today to be joined by Catherine West and Samantha Joseph from DPH because we want to talk more about vaccine clinics. Catherine will be talking about vaccine clinics, perhaps for the end of this school year, for this summer, and how we can think about vaccine clinics as a great step for back to school, which I know is already on our minds. All of us working in schools, we know this is the time of year that we're closing out school and thinking about starting school again. It's a tricky time to do both. And so how can we have vaccine clinics be at the forefront of our thinking as we go into next year? So we'll conclude with that section at the end of today's presentation. So I'm going to slow down so I don't talk like an auctioneer, because I know that there are a lot of things that we've been wanting to get to with you, and we're really excited to bring this information today. So we're going to talk about our data, as always, just briefly, then go to the changes to the testing program that the commissioner just referenced, but we'll go through it step by step. Put your questions in the Q&A. We'll make sure we save time for that at the end. Then today we also released information collectively from DPH on the mass.gov website in conjunction with the Executive Office of Health and Human Services, that is quarantine and isolation. So Q&I is quarantine and isolation guidance for schools, childcare programs, and then children's recreational camp programs. So that is information that's fresh as of this morning, and we'll want to walk through that in detail. And I know that Jeremiah and Meg are going to help keep me on the straight and narrow with that and correct anything that I might say wrong. Today, for today's presentation, just to add to the degree of difficulty, I don't have the preview slide up on my screen. So if I pause a little bit as the slides come up, we'll just fill in with some good fillers. So as always, appreciate the work that you've done. I think it really shows up on this slide, the data that we continue to report on our website. Obviously, there's less testing going on in schools of the traditional testing, the legacy testing, like pool testing and test and stay, because we've converted so much to at-home tests. And I think it's really notable, and Jeremiah, I'd love for you, if you want to add in on this, that about 3/4 of testing of school-aged children right now is happening at home. It's happening through self-tests. The technology has really shifted, and I think back on the 2 years that that our team has been doing this together, there have just been so many advances in testing, and we've kept kind of evolving the program. And now the program is really at a point where most of the testing is happening at home, and that's part of our rationale for the changes that we're making to our testing program for this summer, for next school year. But Jeremiah, anything more that you wanted to add about just the changes that you see through the data and where testing is happening?
Honestly, Russell, nothing in particular. I think it's just hard because time has done such funny things for us all over the last 2+ years. It's just hard to really appreciate how much the landscape in testing has changed over the last 2 years. We are in just like a very fundamentally different place than we were even a year ago.
Yeah, it's really true. The availability of the at-home tests, which we are now referring to, just so that we all begin to get the parlance down, across all of state government, we're calling self-tests. So you'll hear us say self-tests instead of at-home tests. So those self-tests are really, the way in which business is being done now, and that's good. So we're just embracing that and having that, the data kind of frame our planning as we go forward. So let's talk about those changes. Commissioner Riley began to describe what's happening for this spring, this summer, and next school year, the start of next school year, which we're calling fall. So let's just take it step by step. And like we said, for the remainder of this school year, there are no changes. So the program you have right now today will stay in place. Obviously, we're so close to the end of the school year. We don't want to make any changes. If you're doing pooled testing, keep it going. The small number of districts that are doing test and stay, it's your choice to keep that going. You certainly can. And a requirement that we had previously in place about switching to self-tests, right? We used to call them at-home tests. Now we're saying self-tests. There was a requirement that you had to be using either pooled testing or symptomatic testing in order to switch over to our self-test program. We are not keeping that requirement in place for the rest of this year. So if you are wanting to switch away from perhaps test and stay, there aren't that many schools and districts still doing it, but if they wanted to, they could just switch directly to the self-tests and not have to maintain, for example, pool testing. That was a concern that we heard from people. So just note that, by and large, though, we don't expect a lot of changing because we're just so close to the end of the school year. As we look at the remainder of the school year, there are a couple other details, though, that we want to make sure that you're aware of. And the first one is that, how I've been saying the word self-test. We put a link into both this webinar and Lauren, have you put the memo into the chat? I haven't had a chance to look yet.
I have not put the memo yet, but I will do that next. I just put the webinar slides in the chat.
Excellent. Okay, so either referencing the webinar slides or the memo that tracks really closely to these slides, you'll see that we've included the link to the state's general self-test guidance. So as we're all across, I think it's helpful that we're using the same language, same processes for implementing self-tests, and that the information that you need is there on the state's general self-test guidance webpage. So please use that as a resource. The other really important detail, particularly as we look ahead to some end of school year events that are upcoming, I think about graduations, for example, that you could make self-tests more widely available for in-person school-sponsored events to both students and community members. So we're kind of open to you ordering more tests to cover, an event that is upcoming. You might still have senior prom coming up. You could have graduation. You might have field days, other things that you want to do just to have that extra safety layer that self-tests provide. And you could, through the ordering with CIC, increase your order to be able to make more tests available, which will be important. And then, but we want to make sure that, we don't use testing as a requirement for participation in those events. So making it optional, making it even suggested, but not required. And then, we always want that opt-in. So if somebody, chooses to take that test before an in-person event, if there's just a quick way to get them to opt in, that's really helpful. And so we continue to request that you ask participants to opt in order to receive self-tests. So I hope that's helpful, and I'll make sure that we answer any questions that you have about that as we go forward. But we think that that will be an important way to end this school year, particularly with a lot of the events that we know you have at the end of this school year. As we look ahead to summer and fall, so there's sort of a clear line of demarcation between the end of this school year then and the summer and the fall. So the current state-run, state-coordinated K-12 testing program will end at the end of this school year. So the way that we have set up and operated the system will not continue beyond the end of this school year, but there are some key differences between the summer and the fall that I'll talk about right now. So first of all, for this summer, we will provide self-tests, and the commissioner mentioned this, self-test for symptomatic testing in the programs that the school districts run. So schools or districts, your programs, the ones that you run, you will be able to provide those self-tests for. Now, there are other camps that exist without an affiliation to the schools. And sometimes it's a little gray, it's a little mixed as to, is it a school affiliated program or not? Is it town, city versus school? But I think it's good for you to know that there are tests available to camps separately. And so we're, camps writ large, both run by districts and schools, and camps that are run separately and independently will have access to tests. So that's why we're just stressing, the summer programs you run, like a summer camp that the district runs, or acceleration academies, or extended school year, ESY, you will be able to order self-test for those. And there's some really important details about how to order for the summer that I'll go over in just a minute. So, please tune in closely as we go through this so that we make sure that we get the right details together to hit the deadline that we have for ordering those self-tests for the summer. We will not have staffing, software, or other services provided through CIC Health available as of this summer. So you'll be able to order supplies before school ends, have them on hand, but we won't have the staffing, the software, and the other services provided from CIC Health during the summer. And any staffing that would be necessary to implement symptomatic testing would have to come from the district or the school for those summer programs. And I know we already got a question about that in the Q&A, appreciate it. So we're just trying to be as really direct and clear as we can in this presentation about what's coming. The portal that exists that you use right now to access student information about testing will continue to be up and available through the summer. But what's really important is that the consent that the parents have currently signed is for the current testing program and everything that comes with it, including the way in which information is shared with labs, shared through CIC. There are a lot of facets to this consent that the parents have already signed. So we need you to be thinking about, you need to actually get a new consent for symptomatic testing for this summer and fall. The consent that parents signed, it has things that are no longer applicable for what will now occur as the state kind of run elements of the program cease to exist as of the end of the school year. You'll need to have your own consent for symptomatic testing for this summer and fall if you implement it, right? So it's your choice as to what you do during the summer and fall. But if you do continue testing in schools, you would need to make sure that you have consent for that because it wouldn't be appropriate to rely on the consent you got for this school year. Again, because the programs are different, parents will be consenting to something different during the summer once the information is no longer going up through CIC Health the way that it has in the past. So
Russell, can we just stop here for a second? There are a lot of questions. I just want to double down on what's happening over the summer, the types of tests. You'll receive self-tests that can be used in school, assuming that you have the right consent from your students during your summer school-based programs, as well as the self-test can be sent home for families to use for at-home use. And so we'll go through the ordering process right now for how you'll get that bulk order to cover your summer school participation and your summer-based programs, but it can be used for in-school purposes as well as at-home surveillance using the self-tests or what we formerly called the at-home tests. So just wanted to clarify that because there's a lot of questions coming in, and so to not have to answer every individual one, but I hope that helps people.
Yeah, thanks, Lauren. So it's the iHealth tests that you're ordering right now that you'll be able to have access to this summer. So we're not going to continue on with BinaxNOW now during the summer, for example. It will all be iHealth. And those tests can be used in the schools. So you can use an iHealth test in school and you can send it home. It can work for both. So if we can just sort of, shift gears to thinking about not having obviously pool testing or BinaxNOW, instead, it will all be iHealth for this summer. So let's talk about that ordering that has to occur. So we want to make sure that there's a difference in how you order based on what choices you've made about how you participate in our testing program. So most schools and districts out there are already involved in our self-tests and already order self-tests, previously known as at-home tests, through the CIC portal. So if you are already participating, notice the title up at the top of this slide. If you are already participating in our self-test option, what you will do is you will order more self-tests through the CIC Supply Hub. And what's really important about this is that you need to make sure that the order that you put in next Wednesday, June 1st, is expanded to include the total number of total number of self-tests that you anticipate needing, that you estimate needing for this summer. So it's not going to be an exact science. You will be able to order those tests through the Supply Hub, just like you normally do. So everyone who's out there already ordering tests on a biweekly basis, every other week, when you go into that, into the Supply Hub and you order your self-test or just check to make sure the number is correct or reduce the number or increase the number, whatever you're doing every other week, June 1st is the date. Just make sure you increase that number so it includes whatever you anticipate needing for this summer. And then CIC will actually distribute that one-time allocation for summer use alongside your normal at-home distribution during the week of June 6th. So just imagine you're going to get a pretty large order coming in during the week of June 6th that will have your normal order and it will have your expanded order for the summer all in one. So that way, you can get them kind of stored away, distributed to wherever your summer programs are located, hopefully with ample time before they begin. And just please let us know if you have questions about that. But what's important is we have included our calendar. And so like Lauren said, she's put these slides into the chat. Strongly encourage you to print this page, maybe pin it up because this is the date. And you're used to this, you're used to ordering, there haven't been any problems ordering every other week. This has gone very, very smoothly. So just please make sure that next Wednesday though, you increase your order because it'll be the deadline for your summer-based school-based summer programs. Keep in mind that we just didn't put everything on this slide that says that it's both your regular order plus the summer order, but that's what has to happen on June 1st. Just again, going back over that information one more time, on June 1st, you're going to include the self-test you expect to use during the summer program, and you're going to add that number to the regular order for the 2-week period that goes starting June 6th, right? Most of you, that will take you through the end of the school year. However, there are some schools and districts that will continue on even up through the week of the 26th, right? So some schools in Massachusetts will stay open. CIC has been working really closely with schools. They know the number. They know exactly how many schools are out there that we expect to still stay open, through, up towards the 30th of June. If you are one of those schools or districts, please pay close attention to this. You will need to go in and manually enter your number of orders of supplies that you need on June 15th, because after June 1st, CIC will zero out all the orders because they'll be inflated, right? Because of the summer school orders. So they're going to go in and take out all of the orders, zero them all out, because we anticipate that you might not need them. You might already have sort of some extras still on hand. So we want you to be deliberate about trying to get that order right for on the 15th for, estimating how many you'll need to get all the way through. Those of you who still have school the week of the 20th, the week of the 27th. I'm sorry, it's actually really just those who have school the week of the 27th that would need those orders. Anyway, you get the idea. So if you, again, on this slide, if you need to go back over the slides afterwards or share them with anyone, this is where we talk about if you're ordering self-tests on June 15th, you'll need to manually enter the number of tests you are ordering because we will not carry over your order number from June 1st the way that we normally do. So, if we see zeros in there as we get closer to June 15th, CIC is always reaching out and just asking, is this deliberate? Are you sure about this? Particularly just for the districts that we know that will have school beyond June 15th. So Again, just a little bit more information about ordering those tests for summer. Like I said, there are those districts, most of you are involved in our self-test program. Some schools and districts are not. And if you're not doing any self-tests at all and you've never ordered through the CIC Supply Hub, we need you to just email us directly. So if you're not participating in the self-test option, you won't have the ability to order through the CIC Supply Hub. So we just need you to email us your request. And you know what, Lauren, I should have put a date on here. I'm thinking that we just want those by June 1st as well. And we can just reiterate this afterwards too. But I think that June 1st, does that sound right to you?
That's right, yep.
Great. So by June 1st, that's when we're going to be looking for everyone to get their orders in for summer. And if you're not involved in our self-test option, we know this is a little confusing, but if you're a district that's still doing test and stay, for example, and you haven't switched over to using self-tests to get summer supplies, you will have to email us. And so please make sure that you do so. Just moving on to the fall. So like Commissioner Riley said, we will no longer supply self-tests to schools beginning the fall of 2022. So what you have from the summer is meant to be for the summer, and then for the fall, starting in the fall, it'll be up to schools and districts to decide if they are implementing their own testing program. And we encourage you to limit that to just symptomatic rapid testing if you are implementing a testing program. And we've included the link to the statewide contract to where you can purchase self-tests. So let me just pause there and just see, Jeremiah, Meg, Lauren, anything that I missed in terms of key details about this piece for the fall.
Nope, I don't think so.
Okay, all right. Just want that to be straightforward. Really appreciate Meg put this together for us, very wise to think about just as a review of what's continuing and what's not as we go forward. So if you need this kind of all in one place, we have it by season, right? So spring, summer, and fall of 2022, what happens with what type of testing? The surveillance testing, does it continue? Symptomatic testing, does it continue? And the support from CIC Health. And notice in particular, we were very deliberate about managing the consent forms, because that's a really important piece, that once we get past the spring of 2022, once this school year ends, CIC Health Services will no longer be available through the state. And so the management of the consent forms has to switch over to you at that point. And so for summer, just please be thinking about that consent piece, just like I already mentioned. But I hope that you find this table helpful as just sort of all in one place in case there's any confusion about what's continuing and what's not. I think the big difference is that once the statewide testing program ends here at the end of this school year, we are making sure that before we wind down, before the end of this school year, we're providing you with those self-tests to be able to use for your school-based summer programs. That's the big difference. And then by the fall, then we've sort of ended all of the state involvement in the testing program. So we hope that's helpful, and glad to answer questions towards the end of anything that we can do to explain. And then we've included this slide a lot in our presentations, and so I won't go over it step by step, but as a reminder, this is how you get your numbers in on our, for ordering for student and staff self-tests through the CIC Health portal. So we just always want to have that for you as a resource. As we go on, one final thing, really important, is that Binax Now tests and iHealth tests all have extended expiration dates. And some, Binax Now in particular, legitimately will expire even with the extended expiration dates. Many will not. And the iHealth in particular likely will not expire. They have been extended for a healthy amount of time. And so we know there's been some confusion about this in the past, that a test, it seems to, if you look at just the label on the box, it can look like it's expired. And yes, it's a little bit confusing that you have to cross-reference an expiration list, a separate expiration list, to see that the test actually hasn't expired. And we know that, sometimes people have been a little up in arms, this test is expired without, doing that sort of second level of checking that in fact it really hasn't. But as you are looking ahead to this summer, in particular, where we know there are going to be some eye health tests that have a date that looks like it will have expired even before your summer program starts. So maybe an expiration date at the end of June. It's not the true expiration date. And what I really appreciate about our work with HHS and CIC Health, as always, is we're trying to figure out how to be supportive to you in that, because we just don't want there to be a lot of acrimony about these expiration dates when it's not a real problem. And so what we're working on right now is to be able to send you a pack of stickers that you could actually put right on each box that will explain the true expiration date for the tests and if there are any treatment options if individuals test positive. So particularly, what's available for our 12 and up population in the way of medical treatments that are available, just to put that right on the box, because there have been some questions like, what do you do if you test positive? And what are the options that are available for you? So we thought that having the true expiration date and some treatment options, if appropriate, right on the box will be useful to, again, just sort of cut down on any consternation this summer. Jeremiah, anything that you want to add there about the thinking?
Yes. Yeah, thank you, Russell. Just one other thing, because we're getting a lot of questions about this also. None of the tests that you have, none of the eye health tests that you have received from us or that you will receive from us for the summer expire before September. So just want to be very clear about that. It's possible that the test will be extended another 3 months. We don't know. But for the purposes of this spring and this summer, anything that you have on hand and anything we're going to send you in the next month, those are not going to expire before the end of the summer.
And Jeremiah, the idea of the stickers isn't just for schools, right? You're thinking about that Correct. For even kind of broader audience of people using the eye health test. So when you look at these stickers and especially the treatment options, just remember that we're creating them for anyone who uses eye health, so that anyone who gets a hold of that eye health test, it's the same information, even though it would more likely apply to older individuals, 12 and up. And we know that you, representing schools, serve a wider range, and so some of the treatment options just won't be applicable. And so just want to make sure that you understand that there's a wider audience of who we are trying to get to with these stickers. Jeremiah, anything that you want to add about that?
No, I think that's right. These are largely fungible, and we understand if a parent is taking them or if an older sibling is taking them or whatever. We just want to make sure that whoever is taking it and gets it positive has access to the range of therapeutic options that we have.
Great, thanks so much. So a few things, you will be getting more information from CIC Health as we go to close out the program, including an offboarding checklist about what to do with the remaining supplies and equipment that you have. We appreciate that you'll be able to work with your program coordinators on that. CIC Health is going to provide an impact report that you could use to analyze your program participation and to kind of look more granularly at the details from your school or district. And then remember that the functionality of the testing software that you're using right now, so being able to use it to report results, will end as of June 30th, but accounts on Crush the Curve will stay active in case you need to retrieve any information throughout the summer. So I think that's an important detail. We also just want to encourage you to think about the really diligent program staff that you've had, the specimen collectors in particular who've been coming on site really diligently all throughout this school year. And especially, we're just obviously just a little concerned as we provide this information that some people might there could be some attrition as we get towards the end of the school year. So ways that you can sort of recognize staff, encourage them for their resilience, for staying until the end of the school year, I think would be really helpful and would go a long way. Be very local, very immediate for the staff who you have on site. And so, schools are good at this. You do a lot of recognitions at the end of the school year. And so how can you recognize and thank testing staff as appropriate? Could you include them in any end of year recognition events? Are there any ways for students to thank testing staff? And we will actually be providing mock-up certificates of appreciation that you can use as well, just different ways that we can genuinely provide our appreciation for the great work that they've done. I know Lauren and I were visiting a school last week. It was great to see the testing staff just doing their work, going about their business. And we just really appreciate seeing they've been true heroes this year, and we truly appreciate them. Let's move on here to an update on the quarantine and isolation guidance. This is really important because through combined effort across the HHS has helped to organize with DPH and EEC, in particular us, the DPH side that oversees camp programs as well. We now have one guidance on quarantine and isolation for all youth serving programs, essentially. And it's in effect as of today, so important to note that. And a few general important rules of thumb. Self-test is the preferred form of testing. We have information about how to count day 0. It's the date of the exposure or the day the test was positive, the positive test was taken, whichever is earlier. And finally, about masking, just an important detail there too. These are just sort of foundational things to be able to sort of lean in on the slides ahead. We put in big capital letters up here. This is for students. This is guidelines for students. It is not for staff. And so that's a big distinction right now, that this is information for children across all environments, including schools. For the asymptomatic exposed student, quarantine is not required for schools. Students who are identified as close contacts can continue to remain in school programming as long as they remain symptomatic. If a student can mask, they should do so until day 7. A test on days 2 and 5 is recommended, but not required. I know there are a lot of details here, so just appreciate, take a look at the link that we've provided so you can get into this further, but a very important thing to know about. And then, if you're doing test and stay, you can do so for the rest of this school year. But again, here's our recommendation, a test on days 2 and 5, as opposed to serial antigen testing. But again, if you're doing it, you can continue to do it for the rest of this school year. Schools are not required to conduct contact tracing as standard practice, but really must work with their local Board of Health in the case of outbreaks. Isolation, again, big bold letters there for students. So students who test positive must isolate for at least 5 days. If they're asymptomatic and symptoms are resolving and they've been fever-free for 24 hours, they can return to programming. Remember, we're using the word programming because this guidance, like I said, applies to camps, to childcare programs, to K-12 settings as well. So they can return, in our case, to school after day 5, as long as if they're able to mask, they can do so. They must do so through day 10. If they're unable to mask, they must have a negative test on day 5 or later in order to return to programming prior to day 11. Again, lots of details there, I know, but we hope that as you kind of go through it, you'll, this change in procedures will begin to take further root. So symptomatic testing, symptomatic individuals, students in particular, and if students can remain in their school if they are tested immediately on site and that test is negative if they have symptoms. Best practice would also include wearing a mask until the symptoms resolve. If the symptomatic student can't be tested immediately, they should be sent home and allowed to return to school if they test negative or if they've been fever-free for 24 hours. So that negative test is strongly recommended for return if the latter 2 conditions are met. We have a reminder that for staff, we ask that staff at this time continue to follow the protocols for responding to K-12 scenarios. So everything that you have been doing this year, particularly for staff, that remains in place. The changes for the students, very important. No change to the symptoms, which is also important to note. So these are the symptoms that we've been used to all year. And we've just listed them here for you again, particularly as you think about those symptomatic individuals. So I know that was a bit of a gallop through that, but we can look to see what questions that you have. And at this point, Catherine, I'm really happy to turn it over to you. And I'll just change the slides as you tell me that you're ready. And welcome, Samantha, as well. I'll move to the slide where you can introduce yourselves. Thanks so much.
Thank you, Deputy Commissioner. It's great to be here this morning, and we really appreciate the invitation. I'm Catherine West, and I'm joined by my colleague, Samantha Joseph. We are excited to talk about and share some information around pediatric vaccination rates. If you want to go to the next slide. Thank you. Spotlight some of our work with schools to date and the impact that you have had already, And then third, talk about opportunities for schools to support pediatric vaccination through family-friendly clinics, either at the end of the school year, certainly this summer, and certainly back to school. So a little bit about the Massachusetts Vaccine Equity Initiative before we jump into the data. We were created a little bit over a year ago, last February, to support 20 communities across the Commonwealth, as well as priority populations. Our focus is vaccination and mitigation, as well as community capacity and resilience, and strengthening the public health infrastructure. So the slide right now shows the current data for pediatric vaccination, ages 5 to 11, in the 20 VEI communities. So running along the top, we have first dose rate, fully vaccinated rate, the 8-week change, new full vaccinations, and then the estimated number of unvaccinated individuals aged 5 to 11. So at a high level, for first doses, the Massachusetts average is about 55%. And in VEI communities, it's 44%. For fully vaxxed kids aged 5 to 11, the Massachusetts average is 48%, and the VEI average is 35%. So we still have a ways to go from a vaccination perspective, particularly to reach our kids as compared to adults, where the average is 90%. The Massachusetts average head is 90% for first doses and 79% for fully vaxxed. So we are really intentionally focusing on reaching kids and families this summer to close these gaps through hosting and offering family-friendly clinics to reach kids, particularly school-age kids. So I will turn it over to my colleague, Samantha, who's going to walk us through some of our results to date, partnering with schools, and then we'd love to talk with you how we can partner further this summer.
Thank you, Catherine. And truly thank you to all of you for being such incredible partners on the vaccine program. We work very closely with school administrators and public health nurses and schools every day. So thank you very much. If we move to the next slide. So I wanted to give you just a sense of the variety of clinics that we have planned in the past and that we really can plan in the future in your communities. You know, we targeted for April school vacation week, every family-friendly business we could find, you know, across these communities, and really worked with them to develop clinics that we thought would be engaging and interesting with incentives, you know, that would appeal to families to make it, you know, sort of an outing for the whole family. And so just as an example here, we had Six Flags that, you know, anybody who came to that clinic, you know, was able to go for free, have free parking, free meals, and bring a companion as well. We know that it's important, you know, when we offer an incentive to children that we also include the parents, you know, and any other parental guardian. So we always build that into the clinics as well. In over April, we vaccinated about 1,000 people at 43 clinics in 11 communities. And this is just to say, this is only what my team is working on. Of course, there are many, many other vaccinations that take place across the state, you know, but in this specific attempt to do family-friendly clinics, we had about 1,000 vaccinations. We can move to the next slide. I wanted to share, you know, how critical, just to spotlight one particular partnership with a school system and how critical that partnership has been as you look at the data around vaccination rates. So this is specific to Brockton. One of my colleagues, you know, kind of is assigned to Brockton and works with them on a day-to-day basis, and, you know, had worked with the school system around robocalls in particular. And so we wanted to go back and understand how effective were the robocalls at impacting vaccination rates, because it's really important that we're measuring all these interventions so that we know what to do more of in the future. And, you know, kind of amazingly, you can actually, this chart, I understand it's maybe confusing, you know, as you're just looking at it, but basically you see dates kind of along the x-axis and vaccine numbers, especially pediatric first doses is what we're really looking at along the y-axis. And then we highlighted the days where the robocalls went out and where there are school clinics. And you can see that those are the days that we vaccinated the most number of kids in Brockton. That's really what this chart is saying. So without that partnership with the schools, we would have seen significantly less pediatric first doses in that community. I think that just speaks to the strength, of the role that DESE and all the school administrators and school leadership can play in increasing vaccination rates in your communities. So a majority of first doses on those days, and 24% of all pediatric first doses took place at school clinics. We can move to the next slide. So, having said, kind of giving you a background, we are very, very excited and motivated to work with you to really develop a clinical opportunity that meets the needs of your specific community and your population. That can be on-site at your school, either before the end of the year or during the summer, or even as we're thinking about planning for September. That could also be at, a site in your community, a park or a family-friendly business that you think would appeal to your student population. What is most helpful for us in terms of our partnership with you is identifying that right location and then, working with you to make sure that the communication channels that you have to parents and families are utilized, in advertising these clinics. So that's one. If you sort of raise your hand to say you're willing to host a clinic, we really do all the work. We wanted to make that clear. We coordinate every detail, clinical teams, supplies, incentives, so you are really just kind of the space host. And, we do a lot of the operational work for you. The places that we need the most help really are on the advertising. So we can move to the next slide. Oh, and sorry, that slide also highlighted the fact that you may, I'm sure you've heard, the boosters are now eligible for 5 to 11. So every time there's a new set of eligibility, we want to, even if we've done a round of clinics, we want to sort of circle back and do another round because we have this new group that is eligible. So another option, as we talked about, is the communication, right? So how can we work together to make sure that when we have a family-friendly clinic in your community, that every parent and family at your school is aware of that? We would love, the opportunity to work with you to send flyers home with kids. We've heard sort of mixed things about kids actually getting the flyers into the hands of their parents, so we know that there's other types of communication channels as well. Robocalls and texts, we are finding that individual outreach to a family is really, really important in getting the information out. And then any type of other promotion you can be doing around your newsletters and websites and social media. These things really make a difference, as you saw in the case of Brockton. So, and just to say, if you agree to do those things, we can design, all the language, the flyers, we'll really do the heavy lifting and would partner with you on the distribution. And the last one, is something that has that is an idea that evolved out of a meeting with DESE leadership. So it feels to us like there's still a group of people out there who are experiencing an access barrier, that even though, it feels hard because we've put a lot of the, clinics in these communities, but we just want to make sure that there isn't a family out there that is willing to get vaccinated and isn't because they're experiencing some type of challenge. So it feels to us like we're at the point where actually talking to those families at an individual level would be very helpful. And so if there's anything we can do to work with you to provide an opportunity for parents to opt in, to ask for help or information about getting vaccinated. And that could be a communication tool, a survey that you send out to parents, that says, hey, if you need, if you've been wanting to do this, but need some help finding the right place or need a little bit of information, that they could reach out. So we understand there's a lot of sensitivity with the communication with parents, and we, want to be very thoughtful about that. But if it feels appropriate in your communities, if you think that might be a reason why your vaccination rates are lower, that it's not necessarily a hesitation, more of an access issue, that's something we would definitely like to support you in addressing. So those are, kind of the key ways that we're thinking about partnering with you. And there's many others. You guys are, in your schools every day, you probably have lots of ideas too, or you have a sense of, why some of your clinics, we've seen school clinics have, smaller numbers as time has gone on. You might have a good sense of why. Are we doing them at the wrong times in the wrong locations? are we missing out on some key opportunities for promotion? So we would just really love to hear from you about how we can better partner together to increase vaccination rates. So we put a couple of resources up on here. The first one is kind of overall COVID communication resources. The second one is the link that you can use to request clinics. That if you fill that out, that goes to sort of a colleague of mine who would then let us know, depending on what community you request the clinic in, and we could partner with you on that. And then my email address. I would say if you're even like remotely interested in this opportunity in any way, I'd love an email. We could just kind of take it from there. We do have we have a very nice team of people here who really want to work with you on an individual level to make this work. Great. Thank you so much.
I love that. I love that approach of just really wanting to work with schools and districts. I really hope people will take you up on that. Strongly recommend, the idea that we can help get resources out, get materials out, just in ideas, messaging. Communications is so hard. We were just talking about this yesterday about, we have so many schools and districts, and not every school and district has a communications team. So just the way in which you can help to support that. And we just know how important vaccines are. We're not done with COVID yet, and vaccines, obviously the landscape has changed a lot, but vaccines are really an important tool. So appreciate your support there. And, we'll just continue to repeat this information because we want people to really take advantage of this. So thank you so much.
Thank you.
So just as we round out, we just want to again say thank you. So appreciate everyone's amazing diligence, resourcefulness. There just aren't enough adjectives to describe what we see that you have done this school year. And last school year as well. And it's really been about maintaining safe in-person learning for our students, for our staff. And so just want to conclude with gratitude, with appreciation, and with hope. Hope that you can continue to take care of yourself through the summer, excitement about what next school year can bring, and just, resiliency as we go through hard times, like we mentioned at the beginning of today's presentation. Lauren, we're down to about 8 minutes. I know there are a lot of questions. And so one of the key things maybe to start with is that we appreciate our partnership as always with CIC Health, and a lot of the questions about supplies and what to do with supplies, those will be answered particularly through that offboarding checklist that CIC is going to work with you on, that your program coordinator will work with you on to make sure it's clear. And we've already, the HHS team and the DESE team have looked at the list, the directions of what to do with each and every different type of material that you still might have on hand. So you will be getting that information. So I saw a lot of questions about that, Lauren, and just know that, your program coordinator is going to help you with the wind down. We'll also make sure we share these questions with our partners at CIC so that we can all be thinking about, how do we answer these questions collectively in the weeks ahead. So while we won't get to every question in the next, 7-8 minutes, I know that they will be answered as we work with CIC to close out this school year. But Lauren, what stands out to you?
Yeah, so lots of questions, Russell, if we will still be requiring schools to report positive cases on a weekly basis.
So we're not planning to change anything for the rest of this school year, but there will, as of right now, there will not be, there's not a plan for reporting for next school year, but I really want to stress as of right now, COVID has taught us never to make any, firm promises or commitments. And so I'm not going to stand here today and say, you absolutely will not be, reporting next school year. We know that we'll be back with you this summer to follow up about just thoughts about reopening school. And so, keeping things status quo for now, for the rest of the school year is the way we're going to operate. And then looking ahead to this summer to get more information. But once we're not running a testing program, and once we're, we won't have as much perhaps need to get those data as we have in the past, including the positive case rate. But we'll see. More to come on that. No final answer.
Great. Okay, great, Russell, thanks. And then Jeremiah, this was a big question that came up, but can you just clarify if schools will be running a testing program in the fall using self-test, do they need to get a CLIA waiver?
We're still trying to figure out exactly what the answer to that one is. Fortunately, we have a couple months to figure that out. But for the summer, you don't need to worry about that.
But if they're just running self-tests, though, they do not need
it. So it depends on, it's complicated. It depends on exactly who's administering it. So if the student is administering it, then you do not need a CLIA waiver. But if a staff member is administering the test, then it looks like you do. But again, this is something that I would like to square up with the Department of Public Health's legal team.
Okay, so we will provide more guidance on that. Yeah. We'll provide more guidance on that. Okay, great. So, and then Jeremiah, lots of questions about the difference in protocols for staff and students. And so if you could just talk a little bit about that.
Sure. This is something that I'm not sure will continue on forever. So again, I spent a lot of my time echoing Russell. Just to echo what Russell just said, this is something that's in place right now, and I would not bet on this one staying in place forever. But I think that this change in quarantine and isolation protocols in schools and preschools and also camps is a reaction to the burden of quarantine and isolation that students across the Commonwealth have faced over the last 2 years, and kind of gauging that holistic learning loss and the impact of that on holistic student health against, I mean, soberingly, the case rates, that all the testing data that we have from schools, the hospitalization rates, and most soberingly, the deaths rates, and just saying, you know, is this the best way to proceed? And this was something that we engaged with a large number of medical professionals on. And the conclusion that we reached for students was that this was the right way forward. Staff is a slightly different conversation, as I think most of you appreciate the current general population guidance, just for, you know, folks out there and about in Massachusetts, has a higher bar for quarantine and isolation than teachers are subject to and school staff are subject to right now. And that's what I would say about that.
Great. Russell, I think Jeremiah and I did a decent job trying to answer some questions in the chat throughout. So I don't have anything else for the larger group right now.
Great. Thanks, Lauren. And thanks to everyone who's joined us today. Let me stop the share. And we, like I said, though, we will take these the questions that have come in and look at them more deeply ourselves, as well as follow up with CIC Health and the PCs to make sure that you get what you need to close out this school year. We'll very likely be back with you this summer to talk about any of these other details as we start next school year. And again, from the very bottom of my heart, I just want to thank you for everything that you've done this year to make our schools safe and welcoming places for our students and our staff and our families. So I hope you have a very good summer. Thank you to Catherine and Samantha for joining us today. Again, just a huge note of appreciation and a reminder to access those resources that Samantha shared. Catherine, any final words there?
Also wanting to express my gratitude. I tried to answer all the questions in the chat. There were several around vaccine clinics and can we also serve Western Mass? So wanting to make it clear that DPH Mobile can support the Commonwealth, and we're here to provide additional support as well for communities. So please reach out to us. We're here and happy to support, and would love to work with you.
Great. Thank you so much. Jeremiah, Meg, Lauren, anything else?
I echo you one more time. Just want to say thanks to everybody. It's been an incredible thing to be this close to this work across the state over the last 2 years, and just people have sacrificed a lot to keep kids in school safely. Just thank you.
Definitely. We're all parents here, and we are so appreciative of what you've done for our children. So on that note, we hope you have a great summer, and we'll look forward to seeing you later on in the summer when we have just good information to share about reopening school. Thanks so much, everyone. Be well.